All right. Well, I am going to introduce myself and also jump into this topic here. I am Sheila Roth, Head of Clinical Education here at Pearl, and kind of one of all of you too. So I've been a hygienist, office manager, and just really excited to be here at Pearl now. But this topic is really kind of near and dear to my heart as well, as I worked with owner doctors really closely in a consulting company and hearing, all the things that they go through and all the way down to assistants and hygienists and front desk, and especially in this world right now where we have, this staffing scarcity. So it's good we're here tonight talking about all these topics. Question is really, have you ever paused to consider how your mental health impacts not just your life, but your ability to care for patients? And today we're breaking really the taboo around mental wellness in dentistry and facing the facts head on. I'm really thrilled to introduce our speaker, Dr. Joshua Austin, a practicing dentist, nationally acclaimed speaker, editorial director of dental economics, and also still in private practice with the Thriving Practice as well. Dr. Austin combines deep clinical expertise with a signature, you'll see tonight, comedic style to make complex topics really approachable. He's a master of the AGD, a fellow of the American College of Dentists, and an award-winning leader recognized by the Texas Dental Association and the Texas Academy of General Dentistry. Today, he's going to guide us through strategies to really strengthen mental health, cope with professional challenges, and help us build personal wellness teams, really kind of helping us perform at our very best. If you haven't heard Dr. Austin, you're in for a treat this evening. And Dr. Austin, just really wanted to thank you for taking this time with us this evening, and I'll turn it over to you.
Thank you so much, Sheila. It's great to be with you guys and great to partner with a company like Pearl. It really does a lot for me personally in helping me get through my day. And we'll talk about some of those things like Pearl and how those little things can help make your day a little bit easier. And those things certainly add up. If you scan this QR code, this will take you to kind of an online version of a handout. Handouts on here, some other resources of some things I'll minorly talk about. I make no money from this QR code. This QR code is just a way to give you a more dynamic handout than just a PDF file. And I can and do go back in here and add stuff over time. And so, if I send you a PDF, it's a one-time thing. But with this, it has stuff that's constantly being updated on it, so you can get refreshed information as new information comes out. So just a little bit more dynamic version of a handout. Again, I make no money from it. It is just simply a way to give you a little bit more information here. I love to start with this quote, and I'd like to think that we're in a safe space here, especially in a situation of colleagues and people who are all in the same fight every single day. So I'd like to keep this a safe space and know that many of us may be coming from the same place that I am. This is my dad. And my dad was a dentist as well. I'm a second generation dentist. My dad practiced for 25 years in Amarillo, Texas. And then in 1983, he sold his practice in Amarillo. And we moved to San Antonio where he taught at the dental school. And I'm not sure if any of you are second generation dentists. Numbers say that at least some number of you in here are. The ADA says about 10% of dentists are second generation dentists, which I always find kind of interesting that so many of us follow in the footsteps of those that came before us. And I don't know why you guys got into dentistry, but for me, it was my dad. It's just something that like my patients even ask me all the time, sort of out of nowhere, if my dad was a dentist, which I honestly kind of find insulting because in my head, I automatically translate that question into why on earth would you want to do this for a living if you weren't pressured into it by a helicopter parent? I know that's not what they're saying, but in my head, that's what I hear. And I certainly wasn't pressured into this by my dad, but he is the reason that I became a dentist. Today, it's clear to me that I wanted his approval. I became a dentist because I wanted to make my father happy. I wanted to hear that he's proud of me. I think that's something that probably everyone wants to hear from our parents. I think we're hardwired to seek out and desire that kind of approval from the people that are supposed to love us the most. There's just one problem. I'll never get that kind of approval from my dad because he died when I was 10. And I've been chasing his ghost for the last 35 years. And in fact, I never even got the chance to tell him I wanted to become a dentist. And now, as an adult, I realize it sounds crazy to try to work to get his approval without him even being around. But it's taken me a long time to figure that out. And there's always been an emptiness. There's always been a void. There's always been something missing, like right here. And I've tried to fill this void with all kinds of things that are bad: cocaine, escorts, base jumping. Guys, I'm obviously kidding. Do I really look like the kind of guy that goes base jumping? The other ones for sure. No, I'm kidding. I'm kidding. It's actually achievements. Achievements is what I've tried to fill that void with. Ever since I was 10 years old, I've tried to do things that I thought would make my dad proud because I thought it would make me feel better. When I was in dental school, I ran for and became class president. Didn't make me feel any better. My class picked me to give the speech at dental school graduation. Didn't make me feel any better. In fact, that was 20 years ago tomorrow. Didn't make me feel any better. Um, None of it ever filled the emptiness. I even one time was going through my dad's old stuff and found a lapel pen that was a 25-year member pen to the Texas Dental Association. So I decided to run for the board of directors for the Texas Dental Association, and I won the election. Look at this photo. It was terrible. It was terrible. I had to go to 10 meetings a year for 3 years with all of these old people. Look at this. The only diversity in this room is the two old white haired white guys wearing bow ties instead of straight ties. I'm like Benjamin Button in the bottom left hand corner, aging backwards. And every meeting agenda at 10:30 in the morning, it would always say, "Reminder, board members, take your Lipitor." I'm like, bro, I listened to Kanye driving over here. What am I doing in this room? Okay. What an insane thought process to make me think that this would make me feel any better. The equivalent of this would be going through my dad's stuff and finding a Dallas Cowboys cheerleader calendar and then trying out to become a Dallas Cowboys cheerleader and making it. Who am I kidding? I can't pull this outfit off. I'm a B cup on a good day. Okay. If I try to do those leg kicks in those boots, I am going to tear my hamstring. What was I doing? None of it ever filled the emptiness. None of it ever filled the void. And what I didn't realize is that I started to resent dentistry for not filling that emptiness that could never be filled by it anyway. It was unfair to ask dentistry to do that. And so I started to wear that resentment more outwardly. And I didn't know it, but the people around me started to notice. And I don't just mean my team. We use this software to reactivate patients if they haven't been into the office in a while. And it sends them like a text message or an email if they haven't been in 18 months. And it tries to get them to schedule their recall. And one of the options that they have is to unsubscribe or to opt out of future mailings, like if they've left the practice. And it does ask them a question, like a sort of an exit interview, so to speak, of why they're leaving the practice. And there's a pull down menu of a bunch of things they can pick that would be like the standard things of why someone would leave a dental practice, like my insurance changed, or I moved, or I saw a picture of you dressed as a Dallas Cowboy cheerleader and had to confront some questions about my own sexuality. Any of those kind of things, I think would be the standard kind of things you would find in there. And then it emails us so that we can archive the patient and we don't have to keep bugging them, right? So one day I come to my office and I open up the office email and I'm greeted by this email from Chris, who is seeking care elsewhere because, and I quote, "Dr. Austin just seems so angry all the time." This shocked me because I thought I was a great actor. I thought I was Daniel Day-Lewis putting on an Oscar-worthy performance every day. And I thought my patients loved it and I thought they loved me. And it turns out they could tell. Turns out I wasn't such a great actor. The patients could sense it. They could sense that I was really unhappy. And I remember I looked up from my office computer across the wall of my private office. And I remember seeing something on the wall of my private office. It was this. Maybe Chris is right. Maybe I do have an anger problem because this is a wall that I had punched through the sheetrock of my office for what reason I don't even remember anymore. I don't remember what set me off enough this day. This helped me realize that I needed help, that I needed to talk to somebody. And when I had that realization, I remember being scared because I felt alone. I felt alone because none of my friends talk about this. I'm in a group chat of a bunch of dentists that we all went to dental school together. It's about 15 guys. This group chat's been going on as long as group chats have been a thing on iPhone. I don't remember what year that started. I don't know, what, 2010, probably somewhere in there. And it's 15 guys over what, 15 years now, something like that. And never once in the history of that 15 years has anyone in that group chat said that they were struggling, that they felt burnt out or depressed or anxiety or having panic attacks. Never once. Now, keep in mind, amongst these people, there have been things like divorces, bankruptcies, people have broken up professional relationships in practice, like practice partners. All kinds of really bad things have happened. Parents have died, siblings have died. Never once anybody ever said that they needed help. So I felt alone. But was I alone? I mean, I don't know. Like this, the one thing you always hear about dentists, right? If you go to a party and you tell them that you're a dentist, like the one thing patients always say is like, "Is it true?" And you're like, "Is what true?" And they're like, the thing." And you're like, "What thing?" Like, the thing. And you're like, "The bruising in the back of your mouth after you've been that thing." And they're like, "What?" And you're like, "Nah, never mind. Don't even worry about it. Don't even worry about it." They're like, "The suicide." And we always make up a story. We've all have heard it 100 times. It's like, oh no, it's not true. They're air traffic controllers or something like that. That's what we always say. But I didn't know if it was true or not. So I actually did some research. And what I found was kind of interesting. I found this article from OSHA, from CDC and OSHA data that says dentists are 2.5 times more likely to die by suicide than the general population. 2.5 times. That wasn't even the biggest number that I found. This was from the Journal of Deviant Behavior, which sounds like an unbelievable journal. Like, really, what are we doing reading the Journal of Prosthetic Dentistry when we could be reading the Journal of Deviant Behavior? Being a dentist increased one's risk of suicide by 564%. Let that number sink in. Unbelievable. This is the list of dentists who I either know personally or I could find on Google News who have taken their own life in the last 36 months. And ever since I've started doing this lecture in 2022, I've had to add like 6 names to this list. And I'm tired of adding names to this list. This is something we need to talk about. There's something going on in dentistry. There's something that's affecting all of us. This is also from the ADA. Dentists have double the diagnosed rate of depression, anxiety disorder, and panic attacks than the general population. Two things about this study. Number one is it was done pre-COVID. Number two is this study was done by a self-report. So I think these numbers are actually lower than they should be. I think they're actually a lot higher because people sometimes just don't feel comfortable reporting a yes on these types of questions. This is from the British Medical Journal. 90% of dentists, and this is actually true of dental hygienists and dental assistants, any chairside dental personnel, 90% report musculoskeletal pain at least 3 days a week, 3 out of 7 days a week. 90% of dentists report musculoskeletal pain. So 90% of us hurt at least half of the time. The reason that's important is because if your body hurts, you cannot regulate your mood. So you're way more likely to have things like depression, anxiety disorder, and panic attacks. Also from the ADA, 38% of dentists are frequently or always worried. 34% of dentists are frequently or always physically and or emotionally exhausted. Physically and or emotionally exhausted is how more than 1/3 of us would describe ourselves on any given day. Seems untenable, right? And that's why we have so many issues. That's why we have the issues that we have. If we look at the risk factors for suicide from the ADA, you're going to see a lot of things with red arrows here that look familiar. Well, things like history of mental disorders, particularly clinical depression. Remember, dentists are at least twice as likely to have clinical depression than the general population. History of alcohol and substance abuse. Seems like that's something I hear about dentists suffering from a lot. Feelings of hopelessness. Remember, 34% of us are walking around every day physically and or emotionally exhausted. That's how you get to that point. Next red arrow down, isolation. And I don't mean rubber dams. I mean that 56% of dentists still are the only dentist in their practice. That's even in a DSO situation. So that type of isolation can be very difficult from your friends and colleagues. We don't have the typical work environment that many people have where they work with other people who are at their job level. Physical illness. Remember, 90% of us hurt at least 3 days a week or more. And then finally, an unwillingness to seek help because of the stigma attached to mental health. So I do CE meetings every week. Last week, I was at the California Dental Association meeting in Sheila's neighborhood there in Orange County. The week before that, I was at the Nebraska Dental Association. Hold your jealousy. I know all of you want to go to Lincoln, Nebraska in May. And I do this every week. And every time I go somewhere, I look at the book to see what other speakers are there. So I see if any of my friends are there. And I see a lot of the stuff on the same topics. I see all on fours. I see sinus lifts. I see implant placements. I see full mouth rehab. I see veneers. I see all that kind of stuff, all on four. I never see courses on this. In fact, I'm in Texas. In order to have my license, I have to do 2 hours of continuing education at least every 2 years on human trafficking, which is terrible. Don't get me wrong. What a terrible thing. But am I more likely to run into a patient who's being human trafficked or a colleague who's in severe mental distress? Obviously, a colleague who's in severe mental distress, right? But only two states in the country, Washington State and North Carolina, have any type of continuing education requirement for mental health. You saw the list? You saw the list of names? Every state should have this. Every dentist in the country should have to do at least 1 hour of CE on mental health in order to get their license. I think that's part of the answer here is we just don't want to talk about it, and we need to. So why dentistry? Why dentistry? As Taylor says, I'm so damn tired of running as hard as I can. If you're a Taylor fan, you know. If you're a Taylor fan, you know. I feel like every day I'm running as hard as I can, right? And dentistry is so freaking hard. So freaking hard. And every day there's more and more stuff we have to deal with, right? When we look at statistics for the United States, we will find just of people in general, this doesn't have anything to do with dentists, it's just all adults. 23.4% of US adults suffer from any mental illness, and almost 6% of US adults suffer from serious mental illness. So it's not just dentists who are struggling, it's patients too. It's the patients we're treating every day, right? And why do we care if our patients have mental disease? Well, the data tells us that patients with more mental disease have more dental disease. Patients with more mental disease have more dental disease, particularly two diseases that we deal with every day, caries and perio, right? So I'd like to think that we're empathetic and you know we care about our patients, and I think most of us do. But beyond that, like it affects the dentistry we do. It affects our patient's oral condition, right? So we need to know what's going on. And we just weren't taught a lot about this in dental school. You know, I went to dental school 20 years ago. When I went to dental school, there was only one mental health diagnosis that we were taught by our dental school faculty, and that was the C word, crazy. That was it. That was the only one we learned. Surprisingly, the C word, crazy, is not in the medical literature. And the textbook that outlines all of the different mental diseases that are accepted by the American Psychiatric Association is called the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. It's a big, thick, honking reference book, and it breaks down every mental disease into one of 7 categories. And when you look at those 7 categories, you'll see stuff that we deal with all the time, right? We deal with anxiety disorders every day. There's not a day I go in my office that I don't deal with somebody who has anxiety, right? We deal with mood disorders. I'm going to show you some demographics on mood disorders. It's going to kind of wake your eyes up to that. We deal with eating disorders all the time, right? We see patients with bulimia, with binging, purging, things like that, right? If you've been involved in dental education in the last 15 years, you know about sleep disorders and what sleep can do to the dentition, and how the teeth and the stomatognathic system is a window into what sleep is doing, and airway issues, and all the great work that like Jeff Rouse has done at Spear Education on this. So we deal with this all the time. And of course, we all deal with personality disorders because we all employ dental hygienists. I'm kidding, Sheila. I love you guys. I love you guys so much. I can't work without you, but you are a crew, you dental hygienists. You really are. You really are. The most common disease that you will find a patient in your practice to be diagnosed with is a mood disorder. Mood disorders fall into 3 different categories: elevated mood, depressed mood, and bipolar, which is a fluctuation between the two. Elevated mood is obviously like your mania, manic attacks, things like that, right? Depressed mood, the major diagnosis in there is major depressive disorder, or MDD. This is what we used to call like clinical depression, unipolar depression. That kind of wording has now been replaced by MDD, major depressive disorder. And around 12% of the developed world's population suffers from major depressive disorder. 12%. That's more than who suffers from diabetes. And I hear a lot about an obesity epidemic. I hear almost nothing about a depression epidemic. And yet the numbers tell you that more people are depressed than have diabetes. It's kind of crazy. For many years, our thoughts about mental disease were all based around neurotransmitters. Everything was neurotransmitter based. Every mental disease was a disease of neurotransmitters. And neurotransmitters, your central nervous system is just a network of trillions of neurons, right? And the way neurons interact with each other, the way they communicate, is through neurotransmitters. And so obviously neurotransmitters are really, really important in that, right? And all of these neurotransmitters need to be in the right concentration at the right part of the brain at the right time in order for someone to have mental health, right? And so you can see like all the opportunities there are for things to go wrong here, right? So lots of issues, complicated cascade, right? But it's even more complicated than that. And we're finding new data every year. So this study came out 2 years ago. This is called the bidirectional relationship of depression and inflammation. And if you look in this study, it's a pretty landmark study. It shows that patients with major depressive disorder had a unanimous increase in aberrant pro-inflammatory cytokines like interleukin 6, tumor necrosis factor, and C-reactive protein. Where have you heard about those before? Have you heard about those? You've heard about those in periodontal disease. So what we see is we see stress triggers alarmins in your immune system that trigger your innate immune cells to increase production of these pro-inflammatory cytokines. And the pro-inflammatory cytokines in the brain trigger depression. So when we look at these, all of these cytokines can cause issues with serotonin reception, dopamine reception, norepinephrine, can change mood, sleep disturbances, anxiety, all kinds of things are affected by interleukin 6, interleukin 2, tumor necrosis factor, C reactive protein. Those are the same things that we see in periodontal disease. So the current thinking is this: chronic long-term inflammatory disease of the endocrine system is diabetes. Chronic long-term inflammatory disease of the vascular system is heart disease. Chronic long-term inflammatory disease of the periodontium is periodontal disease, and chronic long-term inflammatory disease of the brain is major depressive disorder. Depression is a chronic long-term inflammatory disease, and we should treat it the same way. We should treat it the same way we treat diabetes and hypertension and hyperlipidemia, right? It's no different than any of those. There should be no stigma. There should be no anxiety about talking about this with patients. It's totally okay. The same way you wouldn't be embarrassed to ask your patients if they have diabetes or if they have hypertension, right? It's the same thing. These are the same things. These are just different organs that these diseases are acting on. Now, we've all heard a lot about the link of periodontal disease and systemic health, right? And if you have periodontal disease, does that mean you have heart disease? No, of course not. We're understanding that more and more. But what we're seeing is this like Venn diagram overlapping of the risk factors, right? And that's where this falls in the same way. Those risk factors overlap on the Venn diagram, right? So when you see patients, don't be embarrassed to ask them about these things. It's okay. Have it on your medical history, right? You really want to ask your patients what medications they're taking. Really important stuff, right? Are they taking antidepressants? Because it can affect things like bruxism, dry mouth, periodontal stem cell regeneration, and osseointegration to implants. All those things can be affected. So a lot of those citations are in the handout that I posted on that QR code. So this is really, really in depth. And so I want to make sure that you have an understanding about how this can affect patients. When we get back to us as people who happen to be dentists, right? Again, we talk about dentistry being really stressful, and it is. There's so much things going on at one time, so many things that we have to manage, and all of these things can add up, right? All of these things can add up. And at the end of the day, I think you need to spend some time figuring out what your triggers are. What are your emotional triggers? What are the things that cause you to have these negative thoughts? What are these things to cause you to have spiraling thoughts and to have these depressive episodes and things like that? And I look at it like when I look at a case that needs to be treatment planned. The first thing that I do is come up with a problem list. And then once I have the problem list, I can make a treatment plan. And so your triggers are your problem list, right? You can't come up with a plan to deal with your triggers until you know what triggers you. So you've got to spend some time figuring out what triggers you. And here are some of my triggers, right? You may agree with some of these. You may agree with none of these. These may apply to you 100%. These may not apply to you at all. But clinical failures bug me. I take them home. I take them home. When I see that crown that I did on recall and it's got an open margin on it or a current decay around it, I remember it. Think about it that night when I go to bed. I know you're not supposed to, but I do. Social media and the access for it just tends to be really detrimental for me, and it's something that I really have to manage over time. Hate getting a bad Google or Yelp review. It's just brutal. It's just absolutely terrible. And it's the thing is it's the bad Google reviews never about dentistry. It's always about their like $50 Delta deductible. It just irritates. Like, why don't you leave the 1-star review for Delta Dental, not me? I do not understand it. Disorganization and clutter just really bumps me. I do not like that. And I hate running behind. I really hate running behind. If I could add another one on here, it would be hygiene recall exams. I don't know why it affects me so much. I used to like watch football, and you watch like Peyton Manning or Tom Brady, and they had just run a play, and like the defensive lineman on the other team got right through the line. There was a missed blocking assignment or something like that, and they just got like obliterated, right? And you'd see like Tom Brady yelling at his lineman, and I always be like, "Man, chill out, man. It's not that big a deal. It's just a game." And that's how I feel sometimes, like when I get asked to recall when I'm like knee deep into 3 other patients, and I'm like, "How am I supposed to get up and go to recall right now? Like, come on!" I feel like Tom Brady, like yelling at his line. But yeah, IT recall exams like unnecessarily bump me because I feel like I have to drop what I'm doing because I got to keep their schedules on time, right? So like I'll sacrifice my schedule running behind for that, and it just is this like cascade of negative thoughts. So once you spend some time coming up with your triggers, you can come up with a plan on how to deal with those triggers. So one of them for me is my favorite one. The first one, avoidance. I love avoidance. It's my favorite one. It's the best thing and actually can be a really good strategy, right? If you're deathly afraid of snakes, can you live a life where like you never deal with snakes? Yeah. Yeah, don't go hiking. Don't go camping. Don't go mountain climbing, right? I've never seen a king cobra slithering through a Lululemon store. I've never seen a rattlesnake at Neiman Marcus, right? Like a 5-star hotel has never once had a coral snake in it. It's never happened, right? Like just like avoid some of these things, like not put yourself in those situations, right? Some things you can do that on. Can I avoid clinical failures? Yeah, I can retire from clinical dentistry. I can retire from that's the only time you're not going to have clinical failures is when you retire. If you're doing clinical dentistry, you're going to have failures. That obviously doesn't apply to this. Can I avoid social media? Yes, I will show you how in just a minute. Can you avoid getting a bad Google or Yelp review? I maybe to some extent, but at some point, one's going to walk into your office like ready to go off, and you're just going to have to deal with it. Can you avoid disorganization and clutter? Yeah, to a certain extent, but you also have to remember. I remember one time I went to a lecture and it was a really well-known lecture, like Mount Rushmore of dental lectures. Okay, I'm not going to name who it was, but like everyone in here knows the name. And they plug in their laptop, and while they're getting everything set up, you can see like on the screen, you can see their desktop. And their desktop is just like files and folders just mismatched everywhere. No sense of anything. I literally got up and left. Like I'd spent like $1,200 on the CE because there's a well-known speaker. I was like, I can't listen to this. And like if that's what this guy's desktop looks like, I can't listen to what this guy has to say. Um, so like I can avoid disorganization and clutter, but I can't avoid everyone else's personality types, and not everyone is as fastidious about it as I am. So I need to learn how to deal with that better. And can I avoid running behind? I don't think you can. I think dentistry is a game where at some point something's going to happen. You're going to try to deliver a crown, and it's going to need a bunch of adjustments or something. You're going to miss a block. You're going to break a root trying to take it to that. Like stuff's going to happen, right? What I need to do better is react to it. And running behind ruins my day. And it's probably fine that it ruins my day. But my toxic trait is that when it ruins my day, I have to ruin everyone else's day, you know? And that's the problem because it really is not everyone else's fault. So I'm sort of like the cellist on the Titanic, right? Like we've hit the iceberg and the ship's going down, and I've made my resolution that I'm going down with the ship, right? And here I am on the deck of the Titanic playing my cello, and my dental hygienist runs by with her violin, and she's running for a rescue boat. And I'm like, no, bitch, get in line. Like you're coming right in here. Like, no, you're not getting rescued. You're gonna play with me as this thing goes down, right? Like it's not their fault, right? Like that's the thing that I need to get better with doing over time is not dragging everyone down with me, which is what this demented part of my brain wants to do. It wants to, if I'm miserable, everyone else needs to be miserable around me. And that's probably a really poor way of looking at it. Realizing intentions kind of specifically relates to clinical dentistry. So when you sit down to do clinical dentistry, um, not everything's going to cooperate. Like this is biology, and sometimes the easiest procedures don't work, right? Like you can't control biology. So it may be an implant that is the simplest implant of all time and it fails. It may be an Invisalign case that is the simplest Invisalign of all time, simplest Invisalign case of all time, but like none of the movements execute. Patient may or may not be compliant. You don't know, but they insist that they are. Attachments fall off. Can't get the IPR done. Like just stuff, right? Like, and at the end of the day, like you tried your best, and sometimes biology doesn't cooperate, right? You need to recognize that. Not everything is our fault, even though we're trained to believe that it is. Physicians don't have that for some reason. I don't know why. Why we have that thinking, but physicians don't. That obviously comes from dental school, but I wish I could identify the sort of moment of that. I don't know. I don't know if it's the fact that insurance puts these like you do a filling and it's 2 years, you do a crown, it's 5 years. I don't know if that's part. I don't know what it is. I don't know where it came from, but sometimes biology doesn't cooperate, and we have to be okay with that. Breathing makes everything better. If I would have just stopped to breathe for 10 seconds, I would not have punched the hole in the wall. So that's one thing I want to keep in mind. Does that say mediation? That's a misspelling. It's supposed to say meditation. The meeting with your attorney is not going to make your mental health any better. In fact, I would argue the opposite. It's supposed to say meditation, which we'll talk about. Therapy, we're going to talk about at the end. It's changed my life. I think having tools to make your practice easier, right? That's where Pearl comes in. Like having this tool to help me in the middle of a busy day when I've got 3 rooms going and hygiene dinging me and I have 4.5 seconds to look at the radiographs. I know that I'm not going to miss anything with Pearl, right? It's just that little thing that makes my life easier. It's not this massive life changing thing. It's like it helps relieve the pebble in my shoe, right? It doesn't move the boulder out of the middle of the path. It removes the pebble out of my shoe, and the pebble out of the shoe is like more infuriating than the boulder in the middle of the road, right? That's what Pearl does, and that's like one little fraction of what it does. It's a radiographs. Plus like the practice intelligence, Pearl voice, like all these things that are added, insurance verification. These are all things that just like make everybody on my team's life a little bit easier. And those types of tools are like tools I'm willing to invest in, right? Because like how much is my mental health worth? It's definitely worth how much for us, right? That's one of those things. We have a few of those products in my practice. Weave is one, having an iTero scanner is one, having a 3D printer so we don't have to deal with impressions and model pouring is another one. Like all those things sort of add up and make them kind of invaluable. And then something I've really tried to focus on the last like 4 years is trying to add procedures that like for lack of using a cliche spark joy, right? Like I think we get really good at determining the things that we don't like, right? As we're in our first 5 to 7 years of dentistry. Like for most of it's endo, right? If you don't like endo, you start referring out all your root canals, right? And that's fine. And we talk about that part of like getting out the things you don't like, but we talk less about like getting in the things that you do like. And so for me, it was Invisalign, right? Like for me, I found Invisalign like 5 years ago. And just like if I had my choice between doing an MOD composite number 19 or doing Invisalign, like it's such an easy choice. It's not even funny. And it's because like the MOD doesn't spark any joy in me and Invisalign does, right? So you got to find your things. Maybe it's implants. Maybe it is Invisalign. Maybe it's dentures. Maybe it's injectables like Botox and things like that. Like find your thing. And what you're going to find is like when you start talking to patients about that thing grows in your practice. My friend Ryan Mullis says where energy flows, gardens grow, right? And so the more energy you put into something, the more you talk about it, the more you talk with your team about it, the more it's going to grow in your practice. So whatever that is, veneers, whether that's all on fours, whatever, find your thing and get really good at it and start talking about it. Do all the CE on it you can. Hang out with people that like it too. Another good friend of mine, Eric Grindler, has a saying that says, "Show me your friends, I'll show you your future." And I think that's 100% true, right? Hang out with the people that help you grow that part of the thing in your practice that sparks joy. And it does make your practice a lot funner when you do a lot of the things you like versus doing a lot of things you don't like. Again, we talked about the problems in dentistry, right? Dentistry is really, really hard. And most of us who go into dentistry are givers. That's why we went into dentistry, right? Like it's standard question everyone gets asked at the dental school interview. Why do you become a dentist? We all say this and we all want to help people, right? And at some point along the way, you were told that you should lay it all on the line. Give it everything you got, 110%, right? And that's such a terrible piece of advice. It really is. I think the reason a lot of us went into dentistry is because we wanted to be in healthcare, but we didn't want to be in a life or death situation, right? Like we didn't want to be in those types of situations. Otherwise, we would have been like vascular surgeons or something, right? Um, and that's like what's great about dentistry is there's no like apart from like a Ludwig's angina, which you may have once every 20 years in your career. These things just don't happen. You know, it's everything is safe. There's nothing that's life threatening. And so to make it seem like you have to give everything you have, it's just I don't know where this thinking came from, and I know where it came from in my dental school. It was a story told to us on the first day of dental school by a dean of our dental school, who kind of told us the story of the young dentist who's been out of dental school for 5 years, has their own practice, and is it's a Saturday morning, and they're getting their daughter ready to go for their first ballet recital, and they're excited to see this ballet recital because their daughter's been working out for a long time. And phone rings as they're walking out the door, and it's a patient with a broken tooth. And the in the story, the dentist has to miss the ballet recital to go fix this broken tooth, and that's sort of your obligation as a healthcare provider. That's part of what that responsibility entails, right? It's sort of the Peter Parker with great power comes great responsibility. Right? And it's just a terrible, it's just a terrible thing to teach a dental student. Because like when I'm dying, man, when I'm on my deathbed, am I going to be talking about that crown prep on number 30? Like, oh, you should have seen those margins. Like, no, no, of course, if I am, put me out early, okay? But you have full permission to snuff me out with the pillow if that's what I'm talking about when I'm on my deathbed. You're talking about your kid's ballet recital, right? Like that's the thing you're going to remember. You don't have to give them everything. For who? For these patients that would leave your practice in 5 minutes if you stop taking Delta? Like, no, don't save some. Save some for home, which is who really matters, right? That's who really matters. And if you take anything from this tonight, take home that. Take home that. So these are some of the things that I've added to these solutions that I've added to my life, and we'll go through kind of each one of these a little bit and talk about how they impact us. Remember, 90% of us hurt 3 days a week, right? 90% of dentists hurt 3 days a week. This was an article that was in the Journal of Dental Hygiene that showed that dental hygienists who did yoga 1 hour a week had longer careers than those that don't, which is pretty wild. Longer careers. So I think yoga should be part of your personal weekly self-care routine, whether that be online yoga, YouTube. The Peloton app has great yoga. The Apple Fitness app has really good yoga too. Like you can do it online. You can go to a place and have the communal experience of it. Like just do it. Just do it. And this is my yoga instructor, Sarah. Sarah is also my physical therapist, but she happens to be a yoga instructor as well. And I ended up at her because I had back pain, just like everybody else. And she saw me as a physical therapy patient and told me I really needed to go to yoga. And it has been something I've tried to consistently add to my life, and it's made my life better. Here I am at Sarah's yoga studio doing child's pose. And Sarah did this photo is on Sarah's yoga studio website, and she did give me a $25 Starbucks gift card in order to have permission to post this on her website, which means technically I am a professional yoga model. So I do need to update my Instagram bio to say that. My LinkedIn needs to say it. Was I nervous the first time I went to yoga? Yeah, I didn't know what to do. I didn't know what to do. I didn't know what to wear. I didn't know any of the etiquette. I didn't know any of the poses. And I was quite honestly scared of farting in yoga. It was absolutely something I was scared of. Fortunately, it didn't happen. Been to yoga a few hundred times since then. Still hasn't happened. Does it happen to other people in the class? Yeah, like every third time. No one seems to care. No one gets kicked out of class. No one makes a scene. It's all fine. It's all fine. Don't worry about it. It's fun. It's a good time. It's a good time. It's the only hour a week that's mine. It's the only hour a week where I don't have my phone. I don't have my stupid Apple Watch. I'm not checking notifications. I'm not checking my email. It's the only hour a week that's mine. I think it's really important to stay active physically with some sort of exercise. Exercise releases endorphins into your bloodstream, into your brain. Endorphins are nature's antidepressant. They basically stabilize the mood virtually instantly. And so exercise is really, really important for this. I think just physically as dentists, I think you need to be doing some kind of strength training at least 3 days a week, and core work to help your body survive this physical onslaught that we do. But some sort of physical activity at least 3 days a week, I think, is really, really important for your mental health. I am a Peloton guy. If you're a Peloton person, find me on the Peloton. You can follow me at Joshua Austin DDS on Peloton. I literally did a 30-minute treadmill boot camp with Andy Spear right before I did this. This was my favorite Peloton instructor, Jess Sims. I think she's gorgeous. I think she's stunning. And there's nothing better than spending 30 minutes with Jess. And it's the community part of it as well. That makes it really, really nice. So do something physical 3 days a week, and it will always make you feel better. Always, always. I think meditation is really important, right? So when I talk about meditation, I'm not talking about something long. I'm not talking about something that takes like an hour to do, or even 20 minutes to do. I'm really talking about 5 minutes of mindfulness breathing. So if you do 5 minutes a day of mindfulness breathing, there's really good data that will show that that lowers the physiologic signs of psychologic stress. So it lowers cortisol, lowers blood pressure, lowers heart rate, all good things for your body, right? So just find 5 minutes a day. I try to find 5 minutes a day. This is my meditation kit, and I have this with me everywhere I go. It's a sleep mask, my AirPods, and the Calm app. And I love the Calm app. I need a guided meditation because it kind of keeps me in line. If I don't have a guide, my brain starts drifting off. But with a guide, I can kind of focus on their voice, and their voices are always very soothing on the Calm app. Breathe in and breathe out. And many of them are British, because British people sound so much more soothing than Americans do with their harsh accents. Breathe in and breathe out. Keep calm and carry on. Keep calm and carry on. No one wants to hear Gilbert Gottfried doing a guided meditation. No one wants to hear Donald Trump doing a guided meditation. A lot of people talking about guided meditation. Let me tell you, it's tremendous. It's tremendous, this meditation. And people have been saying that we're the best people ever at meditating, and we are. No one's ever been better at meditating than we are. We are the best. We are absolutely amazing at meditating. We're meditating all the time. You're talking about JD meditating. He's the best. Elon Pete. Pete is such a good meditator. It's not even funny. I want you to take a big deep breath in, and I want you to take a deep breath out, okay? Deep breath in, okay? Deep breath out, okay? Imagine you're on an island. Imagine you're on an island, a beautiful island, the most beautiful island you've ever seen. I've never been to the island personally. People I know have been to the island, but not me. I never went to the island. I want you to breathe in. No one wants to listen to that, right? Yeah, 53% of Americans want to listen to that. It's pretty crazy. Um, do this for 5 minutes a day. Mindfulness breathing. Do a guided meditation, 5 minutes a day. Do it in the morning, do it in the afternoon, do it at lunch. Do it in your private office. What if you don't have a private office? Go into the storage room, do it in there. Do it in the lab. Do it in the break room. Do it in your car. Do it in the bathroom. The bathroom's fine. Now, is everyone on your team going to think that you're doing a twosy when you're in the bathroom for 5 minutes? Yes, they are. Who cares? Who cares? Do it at the same time. I don't care. Multitask. It doesn't matter to me. Just get it done. You can do it 5 minutes a day. That's all you need to do. Try to limit the amount of time that you're on social media. Before we got started today, Sheila was talking about how she loves TikTok, and that her deal with herself is that she'll only go on TikTok when she's on a treadmill or like an elliptical or something like that, a exercise bike. So I think that's a great thing. For me, I try to set a usage timer on my phone for the social media that I'm on. So I'm going to show you how to do it on an iPhone. I'm going to have to tell you how to do it real quick if you have an Android, because I don't have one, so I don't have the screen grabs. So if you have a Android, step one to setting up a usage timer is go to the Apple store and buy an iPhone. Okay, we're all judging you in the group chat when the group chat turns green. Okay, I'm just saying. I'm just being honest with you. All right. First step, if you have an iPhone like a normal person, go to screen time. Go to settings and then screen time. Under screen time, you're going to turn on screen time. You have to consent to it. Turn this on for you. Although if you have kids, turn this on for your kids as well. Sheila, I don't know if you knew this, the average amount of time that a teenager in the United States spends on TikTok is 5.5 hours. I told you earlier, I've never been on TikTok. I don't know what's there, but I know it's not worth 5.5 hours of my time. So turn this on for your kids too. Unbelievable number, right? It's just, I told you, it's brain rot. It's brain rot. App limit is what you want. So once you hit app limit, it's going to ask you what apps. What apps? I pick the apps that matter the most to me, the ones that get me the most. That's Instagram. 1 hour a day. 1 hour a day. I shouldn't be on Instagram more in a day than I exercise, right? That seems like a normal thing. So set an app limit at 5 minutes. When you have 5 minutes left, like at 55 minutes, it will come up and it'll say you have 5 minutes left. And then once that 5 minutes is done, like the app grays out and you can't even open it until the next day. So it's a cool feature your iPhone has that no one told you that it has. And so set those boundaries. It's really important. I'm not saying like we all need it. We all have to keep up with our friends and loved ones and businesses and all that stuff, but just set a boundary. Therapy has changed my life. Therapy has changed my life. And as dentists, we talk about all the time, like the team, right? The team around you. And I'm not talking about like your dental team. I'm talking about like your professional team, like you're a lawyer, your accountant, your bookkeeper, your CPA, your real estate broker, like those kind of people. And we never bring up therapists, and a therapist absolutely should be on that team, right? It's absolutely something like you are the go-to in your office, and at some point like you need someone to go to, and that's what a therapist is. It has absolutely changed my life. Now you look at the data, the mental health data. It will tell us, the literature tells us that like therapy changes your brain. It actually changes the cellular and structural makeup of your brain, which is crazy because we change cellular and structural makeups like with 34 elevators, 15 blades, and 330 bars, right? But literally, the literature shows talking to someone can change your brain. I don't know what any of these benefits mean. It's too scientific for me. I don't get it. But just from my life, I will tell you this: therapy's helped me develop healthy coping skills. Dentists, by and large, have terrible coping skills: drugs, alcohol, gambling, sex, junk food. Like we have bad coping skills. We're taught bad coping skills. It's made me have much better coping skills. It's helped me process previous traumas. And then be big T traumas or little T traumas. We'll talk about those as we close here in just a minute. It's made me more empathetic. It's made me a better leader. Made me had better relationships. And honestly, if you look at like when I started doing therapy to now, like my practice is more profitable. And I think part of that is that I connect with people better. And when you connect with people better, you get more yeses to big treatment plans, comprehensive treatment plans, right? Which is kind of what we all want. I'm only going to recommend one book, and this is the book. This is called The Body Keeps the Score. This is written by a guy named Bessel van der Kolk. He is the world's leading expert on psychological trauma. He is the chair of psychiatry at Tufts University in Boston. And the hypothesis of the hypothesis of this book, which is written in layman's terms, it's not a scientific book. It's a very easy read. You can read it in a weekend if you wanted to. The hypothesis of this book is that if you don't process your previous psychological traumas, and all of us have previous psychological traumas, if you don't process those traumas will come out of your body, and they will come out of your body in unhealthy ways. And the hypothesis is based on this study called the Kaiser ACE study. So this was done in the Kaiser healthcare system out of California. Kaiser is a huge healthcare system in the West Coast. And they study, they have millions of data points on millions of Californians over their entire life in the healthcare system. And they follow kids who had ACEs, and ACE stands for an adverse childhood experience. What's an adverse childhood experience? It's things like being abused as a kid, being abandoned by your parents, being put up for adoption, having a serious illness, things like that, like the bad things that happen to kids, the terrible things that happen to kids. They follow kids with ACEs throughout their entire journey through the healthcare system. And what they found was that kids who had ACEs were more likely to have chronic long-term inflammatory disease, like diabetes, hyperlipidemia, hypertension. They were more likely to have drug and alcohol abuse issues, which makes sense. They were more likely to have autoimmune disorders. Explain to me how that works. You got abused as a kid, now you're more likely to have rheumatoid arthritis or lupus. It blows your mind. How is that even possible? But that's what this data showed. And you're more likely to die an early death. If you don't process your traumas will process you, and they will do so in a really unhealthy way. And we all have traumas in our life. And so we all need to process those traumas at some point. And a type of therapy that's really good at this is called EMDR therapy, eye movement desensitization and reprocessing. And it's a really effective therapy at processing traumas. So if you have some of these things that have happened to you in your life and you want to deal with them, EMDR therapy is a great way to do this. That's what I do every Monday, is EMDR. Every Monday at 5:30 p.m. we have an EMDR session. So what are traumas, right? Well, there's two kinds of traumas that van der Kolk talks about. There's the big T traumas. The big T traumas are the terrible things that happen to us in life: abuse, divorce, bankruptcy, loved one dying, right? We all have stuff like that. All that's happened to all of us. This is me. If you look over on the right-hand side of the photo, the kid in the orange baseball hat is me. That's my 10th birthday party. In the wheelchair is my dad about 3 months before he died. My dad in health was 6'7", 260 pounds. He actually played Division I college basketball at the University of Tennessee. And then before, right before he died, he was in a wheelchair and he was 140 pounds. Like being 10 years old and seeing your dad, who is your hero, go through that is a big T trauma. We all have those things. We all had to process them. We all also have little T traumas. Little T traumas are like the awkward thing you said to somebody at a party that you still think about when you go to bed. And the party was 17 years ago. Okay. And those are those little like the cringeworthy things that happen, right? We all have those. I'm going to share one with you. I used to just tell the story, but I realized I told the story different every time and I would always omit some details. And so I just recorded the story one day, but I'm also mentally ill. So I can't stop at that. I had to hire a cartoonist to draw a cartoon to go along with it. So enjoy this video.
Do you guys get a lot of spam calls on your phone? I know I do. Every day, it seems like I get a few. And it got so bad that I never wanted to answer my phone. This was a tech problem, so I went looking for a tech solution, and I found this app called RoboKiller. It's supposed to alleviate this problem in the background of your phone so that your phone never rings when a spam caller is calling. And there's two kinds of spam calls, though. The first kind are robot calls. Those are just like the "we are calling to tell you about your car warranty" calls. And RoboKiller just zaps those without your phone ever ringing, which is great. The other kind of calls are call center calls. Those are harder to deal with, but RoboKiller has a method. It has these pre-recorded conversations to try to keep the call center on the phone for as long as possible, thinking that they're talking to a real person. Meanwhile, it's just the app. The longer they're on the phone with you, the less time they can be calling other people. It's kind of like answering machines. You guys remember answering machines? Such a relic of the past. Everyone had a dumb friend that had an outgoing answering machine message that just said, "hello," and you'd always fall for it, saying like, "Hey, Greg, we're going to B-dubs for the game about 7:30. Gotcha, leave a message." And you're like, "Damn it, I hate that guy. I hate Greg. I fall for it every time. Why do we even invite him to the game?" You guys remember that? You guys have a friend like that? Well, that's what RoboKiller does to call centers. It has these pre-recorded conversations that it plays, and it records all of it and saves it in the app so you can go back and listen to it later. Well, one day my car needed an oil change. So I dropped it off at the dealership at like 7 a.m. And I took the shuttle back to my office. And I'm working away on patience and finally get back to my desk and look at my phone around 11:45 in the morning. My phone says, "RoboKiller intercepted a spam call from this phone number." And I recognized the phone number, which meant it wasn't a spam call. So I was pretty terrified. I opened up the app, and this is the recording of the call that it handled.
Hello?
Hi, Joshua Austin?
Yes.
Hey, Mr. Austin, it's Rosie at North Park Lexus. Are you here at the dealership?
Yes.
Okay, I was trying to page you, so I thought I'd call you. Your car's ready.
Okay.
Come see me at the cashier's office.
Hold on 1 second.
No worries.
Here's the deal.
Uh-huh.
You just caught me in a vocal training exercise mode. I have been training for 6 months to go on to America's Got Talent because I want to be a singer. And I'm looking for like unbiased people to listen to me sing and give me their honest and like heartfelt opinion. So like this could be kind of like The Voice, where you can't see me, but you can hear me and like give me, and you don't know me, so you can like give me like an honest opinion on whether you think my voice is nice or not. Are you cool with that? And
Sure.
just hear me like sing for like 30 seconds, give me your opinion, and then I'm all game to what you need from me. Deal?
Oh, I thought that you were doing that already when you were doing that. Oh.
Okay, ready or not,
Yeah.
here I
Go
come.
ahead.
Key. And it seems to me you lived your life like a candle in the wind, never knowing who to cling to when the rain set in. And I wouldn't like to know you, but I was just a kid. The candle burned out long before your legend ever did. All right, I was a little hoarse there, but can you just like give me your honest opinion about what you thought of that?
I would too. I would vote for you. I would give you a chance.
I need a little more feedback than that. Come on. Give me the goods.
Well,
What do you think? Do I have the heart? Am I going to win $1 million on America's Got Talent?
honestly, I would say you probably wouldn't win the $1 million, but you probably go a couple of rounds.
That's a little rude.
But you wanted my honest opinion.
Okay.
You sound good. I mean, you know. I mean, you sound good. That's why I said you probably go a couple of rounds. I mean, come pick up your car. Your car's ready.
Okay, you know what? I have to go gargle some eggs, so I'm going to cut this conversation short, but thanks for listening.
That is 100% real. That actually happened. And I remember listening to that message in horror because that woman had my car. So I had to go pick up my car, and I was like, I actually thought of letting her keep it. Like that was definitely on the list. But I realized like I can't do that. So I went to go pick up the car, and I remember waiting in line at the cashier station, hoping it'd be someone else. And then of course the person who was like, next, please, I look up and guess whose name it is? It's Rosie. I'm like, oh my God. So I walk up to the front of the line and I'm like, hi, I need to pick up my car. She said, what's your name? And I said, it's a white RX 350. She's like, no, I need your name. I'm like, I can actually see it through the window right out there. It's the third one and on the second row. She's like, I have to pull up your name in the computer to pull up the flip card. So it's like, Josh Waston. And Rosie says, oh, the singing guy. And I'm like, so then I started explaining to her, like, Rosie, here's the thing. It was this app on my phone, and it thought you were a spam number. Obviously, you weren't. I don't know why I thought you were a spam call, but it has these pre-recorded conversations, blah, blah. And never once in the entire conversation do you think you were talking to a robot. I can't believe it. It's a 1 in a million shot. Can you believe it? Blah, blah, blah. And I'm like, giving you this whole big, like, PhD level dissertation about it. And it's just flying right overhead. I'm just seeing like blank space. The lights are on and no one's home. So I realized at some point, like, I'm explaining myself to this woman and I don't have any reason to explain myself to her. Like, there's whatever. And so I'm like, you know what, Rosie, no, I'm going to get out of your hair. Here's my credit card. You run it for whatever I owe you for. And I'll just take my car and get out of here. And so she's like, okay, great. She runs my card. So go stand over there. They're going to pull your car around. Here's your receipt. Have a good day. I'm like, thank you so much. I'm walking away. I get like 5 feet away. Rosie says, Mr. Austin. And I turn around and she says, it's going to be a no from me, dog. And I'm like, you still think it was me singing? And was it me singing? That's a little T trauma. I've been thinking about that since that happened every night for the last, 9 years. Okay. And I share it here with you guys so you can laugh at my pain. Sometimes you have to do EMDR on even things like that. If you don't know where to find a therapist, and I totally get it, it's super easy to ask your friends, like, where do you get your hair cut? Where do you get your nails done? It's much harder to ask your friends, like, hey, you're crazy. Where do you go? You're going to have to find it online, right? So the AAMFT is a good place. The American Academy of Marriage and Family Therapists, aamft.org. They have a find a provider tool that has a area where therapists can list themselves by their core focus, their core philosophies and beliefs. I was looking for somebody who specialized in previous trauma, the loss of my dad. And I found Holly, who's amazing. Because of me, Holly now sees half of her clients are dentists, which I'm sure is a weird curveball for her career that she didn't expect. But all you really need is someone who's licensed in your state. So Holly is in Dallas. I'm in San Antonio. I've never met her in person. Everything is virtual on kind of a virtual version of Zoom, and it works really well. So aamft.org is a great place. Psychology Today, also a great place. psychologytoday.com, great find a therapist tool. Again, you just need somebody who's licensed in your state. Holly is licensed in 7 states, weirdly. She's in California, Texas, Colorado, New York, and I think a couple others. I don't even know. So if you want her information, email me. I'll give it to you. She sees like half her role as dentist, which I think is kind of wild. And I sort of feel bad for hijacking her career, but it is what it is. When I first started giving this lecture a couple years ago, this was the title of this lecture. And I really like this title. The only problem is that no one knew what the hell this meant. And I think the reason I like this title so much is that I had just hit an edible pretty hard when I came up with it. I'm kidding. And I just thought it sounded cool. But I think at the end of the day, we as dentists are focused so much on minutia, right? We refine our margins with red stripe diamonds until they are perfect chamfers. We polish our anterior composites until they're so bright we can see our double chin reflected back at us in them. If we could just spend a portion of the time that we spend on our margins or our polishing on ourselves and our mental health, we'd be better. Our patients would be better cared for. Our teams would run better. And most importantly, our families would be better. I talk a lot about my dad. I think a lot about my dad. And it used to be my life's goal to be the best restorative dentist possible. And I've come to realize that that goal is really unhealthy for me because it's totally one-sided. It ignores the other, even more important parts of my life. So I changed that goal. It's now my goal to not only put in the work to be a good restorative dentist, but also put in the work to keep me centered as a person. So my patients and my team and my family can sense how grateful I am to have them in my life. I don't want to become one of those awful preventable statistics. And that, my friends, is something I think my dad would definitely be proud of. If any of you have felt any of the things that I've talked about today, I want you to know you're not alone. You're not broken. There's nothing wrong with you. You're going to be okay. Any of you can reach out to me anytime at this contact information. Thank you guys so much, and be well. Thank you, Sheila.
Thank you, Dr. Austin. That was so great. So funny, but yet so serious and also so informative. I was already meditating when you were doing that little walkthrough, even with the crazy guy. So
Love it.
I wanted to ask you, and we're open for a few questions. I know everybody has to jump off here, but I wanted to ask you two questions. One is, what do you feel would be, since you've gone through this journey, what would be the first thing you would put into place starting tomorrow if you were able to kind of, you've tested everything. What would you tell everybody on the call? If you just want to put one thing into action tomorrow, what would that be?
It would be finding a therapist for sure. I mean, that's the big thing, especially us as dentists. Like we are so, pushed to be perfect at everything and always have an answer to everything and always be prepared for everything and whatnot. And it's just so nice to have a place where you don't have to have a answer for everything. And it's nice to go to somebody else for some questions and have someone else help you. And it's just so, like, I think so many of us as dentists, we care so much that our boundaries have just gotten so fudged over the years and really become really poor boundaries. And I think that would be where I would start. I think that's number one. Then I think just doing some mindfulness breathing every day. So between therapists and therapy and mindfulness breathing every day, and then just doing something to move your body like 3 times a week. I think those are like 1, 2, and 3. And if you just do those 3 things, like other things are going to get way better. I would not install RoboKiller on my phone because that is just a recipe for having some embarrassment that will bite you one day. Just deal with the spam calls. It's fine. It's fine. They're not hurting anybody.
That's good advice. And then I would ask you one more question about what is a tool in your practice? I know you've talked about Pearl, but what do you feel like, wow, I'm really glad I have this because it makes me really go through my day faster. And if I didn't have this, this would be a real problem for me.
Yeah, so I think I talked about all 3 of them. Pearl is number one. Like just like I said, I say this all the time. Like any dentist can read an X-ray, right? Like if you put us in a quiet, dark room, like any dentist can read an X-ray. It's no big deal. But like I don't have a quiet, dark room where I have 5 minutes to sit and look at an X-ray. Like it just doesn't happen that way. I am trying to do this. It's I always say like any quarterback in the NFL can throw a 20-yard out route, right? The difference between like Dak Prescott and Pat Mahomes, who's like won a bajillion Super Bowls, versus Dak Prescott, who hasn't, is like Patrick Mahomes can do it when he has 5 300-pound guys like in his face, right? And like you got to read X-rays like in 10 seconds when you have 5 other things going on. And what's going to happen is you're going to miss stuff if you don't have Pearl. So that's number one. Number two is, so second opinion is just like boom, like that's it. We have the other stuff, the practice management stuff from my front desk team that really helps them, practice intelligence and insurance verification. Number two is Weave. Like Weave doesn't really make my life all that much easier, but it really makes my team's life way easier. And there's been a couple things that I've tried in my practice that my team has been like, if you stop using this, we're going to leave. Practice intelligence from Pearl was one, and Weave was two. And then the third thing is my iTero. Like if I didn't have an iTero to be able to scan patients and talk to them about stuff in the hygiene room and the new patient exam, like I just don't think I could do dentistry anymore without it. I just have to have it.
I love that. And one of the questions in the chat is, how difficult is it to implement AI into your practice as far as the images?
I mean, like at all. Really not in the least. It's really such an easy thing. The hardest thing is just like getting the call set up where they can like get the IT stuff done. I mean, that's really it. And you just like I passed it on to my IT guy, he took care of it. And there's like one day or something like that where you guys like download all the old X-rays or whatever and do like a scan of all of those. That's the biggest thing is just that. Other than that, it's really easy. I have a young associate in my practice. So Andrew is 1 year out of residency. He only would look at Pearl. That's all he would only look at second opinion. I always looked at my other software first and then went to Pearl to catch anything that maybe I missed. He never even looked at the other one. All he would look at was second opinion. So it was interesting just the generational divide between the two. I will tell you the one great thing about second opinion is that it is web based.
Mhm.
It's on a browser. So if I'm out of town and my hygienist is there seeing patients and they take an x-ray and someone has pain or whatever, they can text me and be like, hey, can you look at this x-ray? In the past, I'd have to log in to like go to my PC or whatever to like get into my server and look. It was such a pain. Now I just could go to the Pearl website and go to the second opinion site, log in, stupid thing saved in my phone. And she's like, I don't even have to know the password. It just logs in and I can see the x-ray and I can tell them like, oh yeah, we need to get that in for a crown or whatever. So the fact that it's available for me to look at anywhere, type in the patient's name, it'll show you all the x-rays that you've ever taken for them. It's just such a cool resource to have, to be able to see things and move quickly through your day.
Yeah, I love being able to have that second set of eyes. And also, as far as, mental health, we were talking earlier, we've heard from quite a few dentists that having the Pearl Voice notes, being able to record the conversation. I know we haven't tried that out yet in your practice, but being
Yeah,
able.
I think it's on the microphones are on the way. So I'm excited to try it.
Okay, good. Yeah, that is a game changer as far as giving yourself back some time here. We do have a QR code here. If you feel this might be a good match for your team, we'd love for you to scan that. Set up a team demo and walk through some of the products like the Morning Huddle, Pearl Voice, and also AI for your X-rays. And we do have a question too, Dr. Austin, about great question. Um, do you dismiss trouble patients, and how do you go about it?
So most of my career, I followed the avoidance plan for that of just like, oh, let's just not book them for another appointment and see if they go away. And that's probably not the best way to do it. But yeah, I mean, we too do try to dismiss people. I've always toyed with the idea of giving my team like as a Christmas present, they get to fire one patient. And then they have to like argue, they have to make a case for which patient they're going to dismiss as a team. They got all agree on it. It's got to be like a jury. I want to have them like present a case like with a PowerPoint of like why we want it, and then they have to vote at the end. Like I want this to be like the Academy Awards, and then like we have a Ernst and Young or whatever Price Waterhouse Cooper or whatever do like a envelope, and we have tuxedos and gowns, and we announce who the patient we're going to dismiss is at the end of the year. I think that sounds like a fun idea. But yeah, I mean, we all have the patient that we see on the schedule. We're just like, oh my God, brutal. And then just like drains you for the whole day. It's never as bad as you thought it was going to be either. But yeah, I don't know. It's yes, the answer is yes, you should. And I should do it more. And I think we all could do it more because there's just people that aren't the right fit for us, and that's true of everybody. You can't be everyone's dentist. Sheila, I have a question about the Pearl Voice.
Yes.
So we listen to a lot of Taylor Swift in my practice. Am I going to have like the lyrics of Karma in the middle of all my chart notes?
Absolutely. No.
I mean, I'm fine with that actually. If the Texas State Board, wants to know that Karma is my breeze in the hair on the weekend, I'm fine with that. But does it
Yeah,
know what it's listening to as far as like background and ambient stuff?
yes, it is a really good question though, because we want to make sure that it's only recording you and your patient, and be able to remove other areas, especially background noise, especially when it comes to perio charting, right? You want to be 323, 323, and not hear the hygienist in the next room. So it has gone through so many different practices. I've tried it in my practice where there's 15 ops and we have about 7 hygienists going at once, and it's very fast. So it's nice to not have to worry too much about that. And it'll summarize your notes. You can even put them in a SOAP note. You can add templates in. You can add what type of, etch or bond or what chord number you're using in each prep, so that you can really move through your notes faster. But it is a great question. It has to be fast. It has to remove all of the, extraneous noises and has to be accurate. And that's what we have seen from practitioners. So we're looking
Great.
forward to back. Um, and yeah, I think that again, saving time to get out of the office, sooner is key. And moving through knowing that, when you go to sleep at night, your notes are done and you don't have to worry
Yeah,
about, medically, legally, all of that other great stuff that we're always keeping us up at night. So yeah, really
for
thankful for
sure.
you walking us through such an important topic. And for those of you looking for the CE, that will be mailed out to all of you on this call. So you will receive an email and also a recording of this video. We would love to have you back on some of our additional webinars. We usually do 1 to 3 per month at hellopearl.com/webinar. And we look forward to seeing all of you in the future. And we will say goodnight. And
Thank you so much. Go Spurs, go.
all right. Thank you, Dr. Austin.
Have a good one.
Bye-bye.